Welcome. In this module, we will discuss the etiology, epidemiology, and transmission of Yaws before turning our attention to the clinical manifestation of Yaws and its diagnosis. We will also discuss the treatment, management, and prevention of Yaws. Let us begin with a few questions to get you thinking about Yaws. We will review these questions at the conclusion of this module. Question number 1. Can Yaws be eradicated? Question number 2. What family of organisms causes Yaws? Question number 3. Can animals be a reservoir of Yaws? Question number 4. In what regions of the world is Yaws endemic? Question number 5. How is Yaws transferred? Question number 6. What organs of the body does Yaws affect? Question number 7. What is the first-line treatment of Yaws? Question number 8. How is Yaws diagnosed in a clinical setting? Question number 9. How many disease stages does Yaws have? And lastly, question number 10. Who is most at risk of acquiring Yaws? Let's begin with the etiology. Yaws, endemic treponematoses, are chronic infections caused by treponemes. Yaws, also known as frambosia or paean, is caused by Treponema pallidum, subspecies of Partenue. T. pallidum is a gram-negative spirochetal bacteria. These bacteria have a length of 10 to 15 microns and a diameter of 0.2 microns, a size large enough to be visible under light microscopy. Each bacterium has 2 to 3 flagella at each end, along with a few surface-exposed transmembrane proteins. Yaws are indistinguishable serologically and morphologically from syphilis. T. pallidum is easily killed by drying, elevated temperature, and exposure to oxygen. These organisms multiply once every 30 to 33 hours and cannot survive outside of the human host. Treponemes penetrate human skin and move through epithelial cells via tight junctions. These bacteria then attach to fibronectin-coated surfaces on the extracellular surface of human cells. Once inside the host, the bacteria disseminate quickly, reaching the lymph nodes within minutes. The infectious dose of bacteria is between 10 to the third and 10 to the fourth bacteria. Yaws is the most common treponemal infection and occurs mainly in poor communities within humid and warm tropical areas of Africa, Asia, Latin America, and the Western Pacific. Yaws primarily affects children under the age of 15 and is transmitted through direct non-sexual contact, skin to skin, with the fluid from the lesion of the infected person. Transmission occurs when a skin lesion is present and open on an infected person. The initial skin lesion is filled with bacteria, which can lead to transmission between hosts. Skin lesions normally form on moist areas of axillae, skin folds, mucosal surfaces, and limbs. Skin lesions can recur and heal slowly. The incubation period is 9 to 90 days, with an average of 21 days. Males and females are affected equally, and the peak incidence occurs at ages 6 to 10. Overcrowding and poor socioeconomic conditions facilitate the spread of Yaws. There are two basic clinical stages in Yaws, the early stage and the late stage. The early stage of Yaws can be classified into primary and secondary Yaws. Primary Yaws initially is a papilloma, a circular, solid swelling on the skin with no visible fluid, which develops at the site of bacteria entry. The surface of the papilloma resembles a strawberry that is rich in spirochetes. The papilloma gradually enlarges, erodes, and ulcerates. Secondary Yaws describes a stage at which, after the healing of the original lesion, a similar generalized eruption occurs in moist areas of skin. Crab yaws can occur on the palms and soles of feet. These lesions are keratotic and cause painful ulcerations, making it difficult to walk. The late stage of yaws can occur 5 to 10 years after the initial infection and is characterized by disfigurement of the nose and bones. Bone pain may also occur at this stage. Mutilating facial ulcers around the nose may occur as well. Characteristic Yaws lesions are used to make the clinical diagnosis in endemic regions. In an experimental lab, syphilis serologic tests, including VDRL and FTAABS, are both positive. PCR protocols can be used to make a definitive diagnosis in a lab setting. Dark field microscopy may also be performed to verify the presence of T. pertenue organisms. Treatment of choice for yaws is azithromycin 30 mg/kg with a maximum dose of 2 grams, though benzathine penicillin 1.2 million units for adults and 0.6 million units for children is used wherever azithromycin is unavailable or when the patient cannot tolerate treatment with azithromycin. To prevent the spread of the disease among susceptible individuals in endemic communities, 2 treatment policies have been recommended: total community treatment targeting an entire endemic community, irrespective of the number of active clinical cases, and total targeted treatment targeting all active clinical cases and their contacts, including household, school, playmates, after total community treatment. Total eradication has been successful in India with proper use of azithromycin as first-line therapy. Following this successful eradication, the WHO has outlined an eradication plan with a target of total eradication by 2020. This plan includes total community treatment, followed by surveys every 6 months to detect and treat remaining cases of yaws. This disease has no animal reservoir, and therefore it is preventable by maintaining proper hygiene, use of soap and water, and appropriate clothing. Education of communities in endemic areas with respect to clinical manifestations of yaws for early referral and treatment, along with education of healthcare providers in the recognition and treatment of the disease, are crucial steps in prevention of yaws. Improving the standard of living in endemic areas, as well as providing people with soap and clean water and children with clothing, will contribute greatly towards the eradication of yaws. We will now turn back to the questions from the beginning of the module. Question number 1. Can yaws be eradicated? The answer is yes. Given that this disease has no animal reservoir and transmission can occur only via direct skin and mucosal contact, it is preventable and eradicable. India and Ecuador reported interruption of transmission in 2003. WHO has plans for complete eradication by 2020. Question number 2. What family of organisms causes yaws? The family of organisms that causes yaws is known as Treponematoses. This family also includes the infectious agent of syphilis, Bajel, and Pinta. Question number 3. Can animals be a reservoir for yaws? The answer is no. Only humans act as reservoirs for yaws. Question number 4. To which areas of the world is yaws endemic? The answer is poor communities in humid and warm areas of Africa, Asia, Latin America, and the Western Pacific. Question number 5. How is yaws transferred? The answer: yaws is transferred by direct, non-sexual, person-to-person contact. Question number 6. What organs of the body does yaws affect? The answer: yaws affects the skin, bones, and cartilage of infected persons. Question number 7. What is the first-line treatment of yaws? The answer: azithromycin is the first-line treatment of yaws. Question number 8. How is yaws diagnosed in a clinical setting? The answer: yaws is diagnosed in a clinical setting by the presence of characteristic lesions as well as the clinical history. Question number 9. How many disease stages does yaws have? The answer: yaws has up to 3 disease stages: primary early yaws, secondary early yaws, and late yaws, which accounts for roughly 10% of the infected population. And question number 10. Who is at most risk to be diagnosed with Yaws? And the answer? Children under the age of 15, with the average age of infection beginning from 6 to 10 years of age. And this concludes our module on Yaws. Thank you for your attention.